What is your number one lifetime expense? I mean, what is the most expensive thing in your life? Is it your home, your kids, your cars? What is the number one expense you have over your lifetime? And the answer I'm looking for is your health. And the reason this is so important is because your health is the most expensive proposition you have. The number one cause of bankruptcy today is health. Somebody gets sick, they can't take care of themselves, they lose their job, they have to declare bankruptcy. And then what else happens is we had Garrett Sutton, who is our attorney on corporations. The moment somebody gets sick, they want to sue somebody because that's how they're going to get their money. So your number one expense is your health. And the ironic thing about this whole thing, today's program is not about, and what most people call health is really not health, it's really money and pharmaceuticals. So just recently we have had Obamacare, which hopefully will be appealed. And a lot of, especially Hillary fans think Obamacare was wonderful stuff, but it's more of the same system. It's a broken, flawed system promoting drugs, not health. And the last part, when this is very politically incorrect, so I want you to listen to this carefully. Listen to this carefully. Obamacare is for poor people. If you can understand that, you'll understand where this program's going, because Kim and I and our friends were outside of that system. The rich today are not in the health system or the medical system. The rich today have the wherewithal, namely the money, to have private physicians. We do not want to go into that system. So it's very politically incorrect. And what you'll be hearing today is what Kim and I spend a fortune on is on our health. We don't spend a fortune on pharmaceuticals and medicine and insurance. We have that, but we spend a lot of time and money on health because we have the money to do so. So we're just in South Carolina with my best friends, and these guys are very wealthy entrepreneurs, and they have private physicians. And the doctors fly in to see them. It's a different world. So it's a two-pronged program today. Is what's your number one lifetime expense, and it's your health. We're going to be talking about the difference between health and medicine and pharmaceuticals. And we'll also be talking about number one cause of bankruptcy is your health. It's a very important subject, so I want you to stay tuned. And it's only going to get worse because we had Alan Greenspan on. He's talking about the rise of Medicare, how it's going to bankrupt the whole United States system as baby boomers age. So this is probably the most important program. It's not about making money, but it's the reason why you should make money, because your health is your single most expensive part of your life. Any comments, Kim?
Yeah, I think the real question is, what is real health care? Because I think most people think health care is something that once you get sick, then you go get health care. But what we're talking about is how to stay healthy so you don't have to get onto the medicines. I mean, the expense that goes, as you said, Robert, as people get older, like they go through 3/4 of their life savings if somebody gets sick, and that's what causes the bankruptcy. And Big Pharma, of course, just they want to, prescribe drugs. So many people are just on drugs today instead of following what is real health care. So we've got 3 experts today that are going to talk about what is health care versus medicine and what can you do to avoid having these big expenses and ending up as a statistic.
And they're more than
in the
experts.
healthcare film.
They're more than experts. They're personal friends, and they're our real
There are physicians and doctors.
The people we go and talk to, we see on a regular basis.
So
it's really funny is that I meet so many people. I had my annual checkup. I smiled and spread my cheeks. That's about it for most people.
I got my flu shots. We were someplace they were giving free flu shots.
Well, that's health care.
Yes,
I'm going, my annual checkup. Like I could be dying of anything, but they wouldn't even know it.
So our 3 special guests today are Dr. Radha Gopalan. Dr. Radha is a cardiologist and associate professor of cardiology at Mount Sinai. And Nicole Srednicki, she's a doctoral candidate for nursing who happens to be Dr. Radha's fiancée. And our naturopath, Dr. Sunil Jain, he's a naturopathic physician and the founder, owner of Rejuvena Health and Aesthetics. And we see him once a week when we are in town to get our preventative health care, not medicine. So welcome to the show, everybody.
Thank you for having us.
And just to let you know, I just came from a grueling 4-week trip throughout Europe, which is eating strange food and going to bed at midnight, getting up at 2 o'clock to catch a plane. And, this is a grueling schedule. I never got sick. And generally, I break down about 2 weeks into the system because the immune system just breaks. But because of Nicole and Dr. Gopalan and Dr. Jain, is that my health at my age is stronger than ever before. And this is the most important thing you have is your health. But like I said, most people just have health insurance, go for the annual checkup, and that's it. So with that, we have Dr. Radha Gopalan. And Dr. Gopalan is the author of a book called Second Opinion, 8 Deadly Diseases. And what reason Dr. Gopalan is an interesting character is because he's both a doctor of acupuncture but also a doctor of cardiology. And he's associate professor of cardiology at Mount Sinai in New York.
So what is your philosophy, Dr. Radha, on healthcare?
Both East and West. What's your thing?
I put it into very simple words that you can understand. And you can look at it as proactive, that we just spoke about, reactive, and defensive. Proactive is the way to health. Reactive and defensive takes care of disease because you react to something that happens to you. But when you're proactive, you're preventing something that is going to happen.
So reactive and disease, something's already physically manifested in your body.
You become symptomatic of some disease, then you are going and reacting to it by taking medications. And your hope is that you are going to get rid of it and get back to where you were, which we call healthy. But we don't even know what that level is.
So when you say preventative, what's preventative?
Preventative is preventing getting to the point of developing a disease or symptoms.
Well, actually, what you're talking about is staying healthy so you don't get a disease.
Exactly.
There's a very big difference between medicine and health, right?
Absolutely. Medicine is not health.
No.
And healthcare, as we exercise right now, is not about health. It's about disease. So we are looking at and defining health by including disease in the definition.
So what is your definition of health?
Health should be defined without the inclusion of disease. So if you look at the WHO definition, it says...
World Health Organization.
Yeah, World Health Organization says health is a state of well-being at mind, body, and spirit and cultural level. Now, if you looked at the definition, it tells us nothing practical about it. A state of well-being. Now, how do you define that? Because you need to understand what the state of health well-being to exercise it at those levels that they are talking about. That's all the definition there is. So we don't have a good definition of health, and that is one of the reasons why a lot of people don't even know what health is.
So let me ask this. You're a doctor of cardiology, which is as high up the food chain as you can get, but you're also a doctor of acupuncture. So when you're standing there working or you're working with a patient, is your brain going back and forth between doctor of acupuncture as well as a doctor of cardiology when you're treating a heart patient?
It does. So as a cardiologist, I prescribe medications. I tell patients the reason they come to see me is they are already in the reactive phase. Or sometimes, as I see it with dying patients, they're in the defensive phase, where we utilize machines to make them survive. Otherwise, they are going to die. So my mind goes back and forth. When you prescribe some medications, good, I've done something to prevent it in a reactive fashion, but my real question to the patient is, what are you going to do in a proactive fashion to never come back to see me? That doesn't happen. Most of the patients keep coming back with the same problem.
So out of, let's say, 10 patients, how many actually become proactive?
Half.
Half. That's not bad.
That's not bad, no.
No, not 5. I'm saying half of one. So it's a very small number of people. Half a person.
I've never seen half a patient.
No,
I've seen one yet.
That's exactly. The reason I say that, Robert, half, is because even the people who want to become healthy don't maintain the being that is required to be healthy. They falter into not being that way and then go back and forth. So if you take a person in their entire lifespan and look at how long they have been in a proactive mode, it's maybe 25% of their time. Or some of them 50% of the time, some of them 90% of the time. And those are the real winners. who have spent 90% of the time focusing on being healthy.
And
So
our
our
third,
oh.
and our third doctor is Dr. Sunil Jain. He's a naturopathic physician, and he's a founder and owner of Rejuvena Health and Aesthetics.
We go to him on a we go to Dr.
Proactive.
Sunil on a regular basis. We do vitamin drips, we do vitamin shots, we do ozone treatments, we do all sorts of things to stay healthy. So welcome to the show, Dr. Sunil.
Thank you for having
So
us.
how did you become a naturopathic physician versus, let's say, a
Medical doctor.
Well, that's a great question.
You have the brains, don't you?
You're not a real doctor, are you?
Right. So, I was really fortunate growing up with a family and close friends who were all in the medical field, traditional medical field. And so I kind of saw the advantages and disadvantages as I was growing up. And I actually had some of my own personal health challenges and that were unsolvable by traditional medicine, mainstream medicine. And I remember distinctly going to India one summer, and one of my aunts had suggested within 2 days of being there that I go see this homeopathic doctor. And so, my parents took me there, and I remember we were there for maybe 15, 20 minutes before he started questioning and asking about my diet. And so he had made some dietary suggestions and had told my parents to give me these little pellets, these little pills, these homeopathic pills to take. And by the time our trip was over and go back home, I should be back to normal. And lo and behold, that's what came true.
Wow.
And
What does homeopathic mean?
so homeopathy is basically a system of medicine where like cures like. And essentially what you're doing is you're taking something that exists in nature that can cause certain symptoms, such as poison ivy. If you were to play around in poison ivy and hang around it, you'd get an itchy rash. If you were to ingest it and be around it continuously, it would actually cause like arthritic type pains. So if you were to come in my office with a skin rash and I ask you certain questions and one thing leads to another and then you tell me you have this really bad arthritic pain that's better with movement, all of a sudden you sound like poison ivy to me. So I'm going to give you homeopathic poison ivy. So basically I'm giving you a remedy of a substance that is treating the very symptoms that it can cause if you were to overdose on it.
So it's not pharmaceutical, not a medicine, it's not a derivative of some other chemical.
No, it's an entire system on its own, and it can be derived from really any naturally occurring substance.
Right.
In fact, Robert, in homeopathic medicine, the tablets that you swallow or the liquid that you ingest really has no substance of where it is derived from. It actually carries the vibrations of that substance. The process by which they make those medications is by capturing the vibration of the essence of those ingredients from which it has been derived.
What is your number one lifetime expense? Your car, your kids, your house, or your health? It is your health. More people declare bankruptcy over health. Any comments, Kim?
Yeah, well, the one thing we're talking about is what is real health care. And the thing that I like with our guests, who we will speak to in just a second, is that our guests are all about you taking control of your health, not letting the pharmaceutical and the insurance companies dictate your health. I think Obamacare is saying the government will take care of your health. The government will dictate your health. We're just saying there are simple, inexpensive things you can do today to be healthy and not have to have these diseases that so many people have. You can be in control.
And our guests today are our real health care guys who take care of us. They are for real.
These are our personal people that we go to, and so we wanted to bring them here to you so you can listen and get the benefits that we've been getting from them for years.
We see them on a regular basis.
Yep.
So our first guest is Nicole Shrednicki. She's a doctoral candidate in nursing. Second is Dr. Radha Gopalan. He's a cardiologist, associate professor of cardiology at Mount Sinai in New York. He's the author of Second Opinion, 8 Deadly Diseases. Radha is both a doctor of acupuncture as well as doctor of cardiology, so he sees the world from the eastern and western point of view. So if you want to take care of your health, please get his book, Second Opinion, before you get ready to die. Do it early. Earlier is better than later. And our third guest is Dr. Sunil Jain. He's a naturopathic physician and owner of Rejuvena Healthcare and Aesthetics, and he's been our guest before. All have been guests before, But every time I go into Dr. Jane's office, I think I'm going into the locker room of the Phoenix Suns or the Diamondbacks or the Phoenix Cardinals, because he has some of the richest, most powerful young athletes in the world coming to see him. And the whole theme of it today is that most people, when it comes to medicine, they just go for an annual checkup, and that's it. Well, I'm healthy. I got an annual checkup. And if they find something wrong with you, then you go to pharmaceuticals or medicine. Whereas Kim and I are very proactive because we practice what we preach. Our health is our most important, most expensive part of life. So I'd rather spend it now rather than wait till it's too late, spend it in the last 2 years, which is when most people spend it. But most people will wait till it's too late, and then they hope some drug will pull them out of the coma they're in. So anyway, we're talking about, and for most small businesses and most self-employed people, healthcare is our single largest expense. It's driving more entrepreneurs out of business.
Yeah. Well, that's Obamacare. I mean, I talked to somebody just the other day, and she said because of Obamacare, now her premiums have gone up $200 to $300 a month, and it's hard for her to operate a business with employees when she has to pay all this money. So hopefully it will get repealed. That's my opinion.
So, Nicole, what would you say to a person who wants to take care of their health? I mean, I talk about the rich now have private physicians, and most of my friends do. They're outside the system. They don't want to be dictated to by what the insurance company says you can take or not take. So what do you sort of, not so much prescribe, but...
What are one or two things that somebody could do today?
If somebody doesn't have, excess money to spend on a private physician, really some of the key things that I like to educate my patients on is nutrition. That's huge. I mean, that's the root of so many illnesses or symptoms. When when you have a very poor diet, this can definitely have a huge effect on your health. So
is it Burger King better or McDonald's?
Well, okay. If you have to go to Burger King or McDonald's, say you're traveling and there's no other options for you, or you can't afford anything else, get water instead of the Diet Coke or Coke, so that's a proactive health measure.
Water is a big part of it, isn't it?
Absolutely. And I'm huge on detoxing. So, again, if you can't afford to go out and buy like a detox cleanse, add lemon to your water, put cilantro and garlic in your diet. These are all detoxing agents that help, leach toxins out of your body, and, they're going to make you feel better.
Are you saying our bodies get toxic because of chemicals and things in the air and stuff like that?
Absolutely. There are toxins everywhere, from the lotion that you put on your body to makeup, to the air you're breathing, and even some of the foods that you eat. I mean, everything's filled with toxins. So we have to, take an approach where we can kind of fight back, because it's inevitable that toxins are out there. And
toxins weaken the immune system, what you're saying, the body.
Absolutely. So again, why nutrition is huge. Nutrition and exercise, sweating is another great form of detoxification. These are simple, inexpensive ways for individuals to stay healthy.
So, Dr. Jane, you work with some of the most powerful athletes, young athletes in the world. Why do they come to you? I mean, what do you do for them that a traditional doctor does not do?
Well, really, it goes back to what I do with all my patients, and what we're all talking about here is treating the whole person. And so when you're talking about a professional athlete, I relate them to just the average person. You want to make sure their body's functioning optimally, making sure they're eating the right foods, making sure they're, if they're nutrient deprived, that they're getting specific nutrients, mainly from food versus supplements. We're making sure that they're detoxifying properly, they're eliminating properly. And we're also looking at their musculoskeletal system from a holistic standpoint. So if they have a chronic knee injury, for example, that was a non-contact injury, I'm not focusing just on that knee. The knee was the end result. We're focusing on other areas that led to the damage and the destruction of the knee. So it's really just looking at the body from a holistic perspective.
And you're outside the whole insurance pharmaceutical system, right?
I am, yes. I choose not to participate. It leaves our practice to where we can actually spend time with the patients, and we're not dictated by reimbursements or anything like that. So it works very well. When someone comes to see us for the first time, it's usually about an hour and a half a visit. Our minimum office visits are about a half an hour each. And so it really gives us time to know the individual. Someone might be coming in with a specific ailment, say they're sick or whatnot, but you dig a little deeper, and it's because they're dealing with some stress in their life, and which weakened their immune system, which then made them more vulnerable to this cold. So you kind of have to look at the body from in a totality perspective, and so that allows us to do that with the time.
And insurance won't allow you to do that.
Well, insurance
won't pay you for it.
Right. Insurance is kind of dictating, the amount of time you spend with the patient, because you have to run through X amount in order,
So what would you say to somebody who's not a professional athlete playing for the Cardinals, who can't afford your fees? What can they do?
I've created a system that I call the sustainable prescription, and basically that's a prescription for a healthy lifestyle. And
you're very much into diet, aren't you?
It focuses on 6 main areas. Yes, absolutely. Diet is the pillar. It's a foundation for everything. If you're not eating the right foods for your body, if you're not eating a healthy diet, then you're basically stressing out the immune system. You're promoting DNA damage, and you're activating genes that are could potentially cause disease.
And you're also a complete vegetarian, right?
Oh yes, I'm a vegetarian.
Why is that? Is it?
Well, I kind of grew up more familial reasons initially, but I really feel it's a healthy way of eating, and specifically, I'm trying to get to more of a raw vegan diet. I think that if you can encompass 50 to 60% of your daily food intake to be raw, I think you're doing yourself a huge service there. But the six main things I like to focus on is nutrition, exercise, elimination, detoxification, sleep, and stress control.
And your website is werejuvenate.com. So go to that website. I want to ask Dr. Rada, you are in the system. How does Obamacare and how does the insurance industry affect what you as a doctor can prescribe for your patients?
It affects in a way where it slows down your progress with the patient. Now, how it does is that you can spend 30 minutes of the time with the patient, or 45 minutes if you want to, but then you have to document that you spend that time, and then your insurance payment goes up. So you can spend the time, but you have physicians.
You get penalized for it.
Right. If you don't document it, you get penalized. I have my colleagues who see about like 40 patients a day. I mean, if you in my
40,
clinic,
40
patients a day.
Holy
so
mackerel.
they allow about 10 minutes per patient. That could be for various reasons. I don't know what it is. But in my practice, where patients come to see me, a follow-up visit is half an hour, a new patient visit is 1 hour, and then I document to the insurance company I spent more than 50% of the time face-to-face with the patient. That's what they are looking for. So it is restrictive, but it is more restrictive not in the time you spend, in what you can do to the patient. That's where the major problem is. I prescribe a medicine and I'll get a call from them saying, you cannot prescribe this. Have you tried this medicine, the other medicine, and the other, which are generic?
Part of because those systems are that medicine is part of their list.
Contract.
Yes,
exactly. I mean, it's
does medicine heal?
Medicines don't heal.
What do they
do?
do?
The body heals. The medicines assist healing. The way I look at medicines is like using pesticide to get rid of pests in your tree, and then you have to actually get rid of the pests when it is at the extreme level where overwhelming the body's ability to recover back to health.
So part of the detox is to get rid of the medicines.
Correct.
So we come back, we'll be talking more about your number one expense is called your health. So once again, we're talking today about your number one lifetime expense, and of course that is your health. And the average Westerner, what their idea of health is, they go to the doctor for an annual checkup, smile, spread their cheeks, and they're healthy. And they go out and they wonder what happened to them later on. And the reason it's your number one expense is most people go bust because they spend all of the money they worked hard for in the last 2 years of their life trying to fight for survival. That was my dad, and he spent everything he had trying to survive the last few years of his life, but he was in pain and misery. So we're also talking about how the rich have the wherewithal to afford private health care versus Obamacare or today's health care prescribed by the insurance industry. Because the insurance industry, all they want to do is make money. It's just greed running pharmaceuticals. So what we're talking about here is health is not pharmaceuticals or medicine. Comments, Kim?
Well, we have 3 very special guests. Dr. Rada Gopalan, he's a cardiologist and associate professor of cardiology at Mount Sinai in New York. Nicole Shredecki. She's a doctoral candidate for nursing. And Dr. Sunil Jain, naturopathic physician and founder-owner of Rejuvena Health and Aesthetics. His website is werejuvenate.com. And these three people are our godsend because they're the ones that every day keep us healthy. We go to them on a regular basis. So we brought them in the studio today to share their knowledge with you because, as Robert said, healthcare is your number one expense. So, Dr. Radha, and somebody's listening today and they're like, where do I start? What do I do?
The first thing to realize, to focus on is you want to be healthy. Being healthy requires being proactive. Proactive requires you develop a habit or a behavior pattern that keeps you in that health without getting into a disease state. You can use medicines. You can use either Western medicine, Eastern medicine. They both have their place in restoring health.
Restoring health.
Restoring health.
Okay.
And when you lose it, you use those medicines to come back to where you were. But maintaining where you are requires one's effort and habits. And, as we talked about it, nutritional diet, proper exercise, proper detox, and being mindful of what you're doing. Most of the time, it doesn't cost a lot of money.
And you're a doctor of acupuncture also. What does acupuncture do? Because the Western mind does not have any idea what sticking a needle will do. Right.
Acupuncture defines health in a completely different way than what we just talked about at the beginning of what the WHO definition of health is. Acupuncture defines health as a state of balanced energy. So it looks at health from an energetic perspective rather than you have a disease or not.
And what do you think about how does acupuncture compare to, let's say, chiropractic,
yes,
which is very popular now?
These disciplines are pretty much similar in the sense that they alter your energy flow pattern. So chiropractic medicine also alters your energy flow pattern through the nervous system and adjusting it. Yeah. Likewise, what Sunil talked about, the homeopathy, is an energy medicine. It influences the energy of the individual. So these are more aligned with health, and then you have medicines that are more aligned with disease.
Is meditation aligned with health?
Yes.
How does meditation give you a healthier body?
The meditation influences you in a different level. It is more aligned with health simply because it makes you become more mindful of your own energy. So if you know how to monitor your own energy, you will recognize when you deviate from the balanced state to an imbalanced state.
So I might feel something that normally, let's say I have a pain somewhere, and maybe I might ignore it. But if I'm more mindful, I'll be more aware of like small pains that are happening, and then I come see you guys and say, "Here's what's happening," and you go, "Well, let's treat it this way."
Even better than that.
Okay.
So when you feel pain, you're feeling symptoms. What you will see when you're mindful is you will begin to feel your energy level has gone down. You might feel your mood level is down.
Okay.
All of a sudden, my mood changed. What did I eat? You're going to ask yourself, and then you're going to come back. And if it persists, you're going to correct it yourself. That's why I'm saying you don't spend money. You're going to correct it.
Right. The big part is that it doesn't cost money to meditate. You can, if that would be one of the best, or go to the gym. It doesn't, or go for a walk or exercise. Those are things you can do. Right?
And
exactly.
and what you're saying is really monitoring. If you just notice you're getting tired. That's not normal. Most people think, it's at the end of the day, I'm tired, I've done this and this. But Dr. Sunil, you're saying, we talked at the break, you're saying that's not normal. People think it's normal because of age.
So there's acupuncture, there's chiropractic, there's cardiology, naturopathic. How is your philosophy coming at this whole thing with health?
Well, it's everything that we've been talking about. It's making sure the mind, body, and spirit are in harmony. And I think what Radha was talking about with the mindfulness is huge because that holds you accountable. If you can sit there and go through your normal day's routine and realize that you're getting tired or you're feeling bloated
or depressed
or you're feeling depressed,
angry.
You look back and you can reflect on what you've done that may have led to that pattern. And just like you said,
because none of this is normal.
This is not normal.
People think sometimes it's normal.
It's very common for people to come into the office thinking that I'm getting older or this is normal. I've had it for years. Whether it's my joints hurt or I'm always tired or whatnot. And these are not normal states. These are reactions to issues that your body's dealing with that are just going on for too long, and it ends up being presenting as a symptom. Our bodies are very, very, very smart. They tell us when we need to pay attention to something.
Yeah, sometimes they call you're ultra healthy human, And you on both sides of the coin also. I mean, you use blood work, use injections, use the most pure vitamins possible, but you're also from the medical side too, right? So what do you do that, let's say, a traditional registered nurse does not do?
Having a private practice, I also, am kind of outside the insurance world, but it's so I can spend the time that patients deserve to really teach them these tools that Dr. Jane and Dr. Gopalan have been speaking about. I can spend the time actually training them how to meditate and how to be mindful. And just from a very basic level, I tell my patients, this is how you start. Clear your mind for a few minutes every day and just be with you. This is, being comfortable in your own skin is part of health and how you can start to identify some of these symptoms.
Once again, it's Robert Kiyosaki, Rich Dad Radio Show, the good news and bad news about money. Again, we're talking about your number one lifetime expense, which is your health. And with the issue of Obamacare and health care going up, and the aging baby boomer and all this. So it's a very important program because more people go bankrupt, not in business, but because of health. And the average person just goes for an annual checkup, and that's it. They're healthy. And then they get sick, and then all their money disappears. That was my dad. Our three guests, these are for Kim and I, these are our personal so-called health advisors. We have Nicole Shrednicki. She's a doctoral candidate in nursing. And then also Dr. Rhoda Gopalan, who's a cardiologist, also a doctor of acupuncture. He's also associate professor of cardiology at Mount Sinai in New York. And he's the author of Second Opinion, 8 Deadly Diseases. It's how Eastern and Western medicine complement each other. But he's also concerned because health insurance is now dictating what you can receive as treatment. In other words, the insurance companies are now playing doctor and is tying the doctor's hands. And our other guest is Dr. Sunil Jain. He's a naturopathic physician and founder of Rejuvena Health and Aesthetics here in Scottsdale, Arizona. We bring them to you because we're fortunate to see them on a regular basis, and we want to share them with you.
So I have a question. We're talking about the aging baby boomers. I am one of them. What is normal aging? Because everybody I talk to, my knees are going bad, my hips are going bad, I'm just a little more fatigued. That's just normal aging. That's just getting old. So let me start with Dr. Rada. What is healthy aging?
Healthy aging is how you feel. Essentially, I tell patients, they ask me, how do I feel when I'm healthy? And I'm going to say, draw you all the way back and say, you feel like when you're in your early 20s, that's what health feels like. Aging has diminished it, but energy-wise, vitality-wise, that's what you should be feeling irrespective of what your body tells you. That you might have a little bit of limitation of moving your joints, but energy-wise, you should be feeling as if you felt in your early 20s. That's what you should be feeling, even when you're aging.
And I can vouch for that because I'm feeling younger and stronger now. And for a while, I let it just run down, just let it go because I was seeing medicine.
Dr. Sunil, what's your definition of healthy aging?
Well, I mean, I think you hit it right on the head there. It's just it's when your mind, body, and spirit are in harmony. When you're feeling that energy, you're feeling that vitality, regardless of your age. We in the United States, unfortunately, have a life expectancy where we rank 42nd in the world. Okay, we spend the most on healthcare than any other country, but we rank 42nd.
Wow.
So it's about having a good quality of life.
The average American, to them, they're not into healthcare. They're into sick care, and then they're into drugs, and they go for their annual checkup. Also, health is the number one cause of bankruptcy. You might be, let's say, 30 years old, but you get hurt in a car accident or something, you're bankrupt because you can't afford it anymore. And the other thing is that the rich are able to afford the best health care in the world, so they stay outside of the Obamacare or the pharmaceutically driven insurance industry. So in other words, the insurance companies are now playing doctor, and that's why our health is going down. We have our programs available on iTunes and Android. And also, all of our programs are archived at richdadradio.com, so you can listen to this program again or your friends and family or business owners can listen to this program, because health care is the number one reason people don't make it as entrepreneurs. They can't afford it. They can't afford employees' health care either. So that's why it's such an important subject today on the Rich Dad Radio Show. Comments, Kim?
Well, all our guests have been gracious enough to stay aside to do the Ask Robert piece. So we have, again, Dr. Radha Gopalan. He's a cardiologist and associate professor of cardiology at Mount Sinai in New York. Nicole Schrenicki, she's a doctoral candidate for nursing. Her company is Ultra Healthy Human. Radha is also the author of Second Opinion, 8 Deadly Diseases. And Dr. Sunil Jain, naturopathic physician and founder-owner of Rejuvena Health and Aesthetics. His website is werejuvenate.com. And we were just talking at the break. I just want to make one quick point, because Dr. Radha, you said the number one country for long life is
Monaco.
Because
the population is comprised of rich people. Wealthy people live there.
So they have the means to take care of their health.
Therefore, they live longer.
Well, one more question. So it's Monaco, but how prevalent is now becoming where the rich have their own private doctors?
It's becoming very prevalent, and it's under the surface. No one knows about it, but most of the rich have their own private doctors. They take care of the health. They try to avoid going to the hospital or having procedures or taking medications. Most of the clients that I think Nicole has, because she's outside of the insurance system and the health system, is they are there to find out how they can take themselves off of the Western medicines, and I'm sure that Sunil has that kind of population, and then utilize natural medications to maintain their health.
Well, I consider all of you are concierge physicians. I mean, we come to you and you take care of us very personally on a one-to-one basis. And I know if anything was wrong, we've called you at the last minute and said, help, we need some help, and you're right there. So
and Sunil's is called Rejuvena Health Aesthetics, and the beautiful people do go to his shop. I mean, there's beautiful women and all the young athletes and professional athletes and all that. But it's growing that the rich are going away from Obamacare.
Yeah, most definitely. You find it a lot more empowering when you can ask questions and get answers to that make sense. Just because you feel a certain way doesn't mean it's because of a lack of a medication. There's a cause for that issue that's developing, and if it's explained properly and in a way that the person understands it, they're more likely to follow through with what you're saying.
So, Nicole, being a nurse practitioner and a doctoral candidate, your clients are pretty proactive, right? And they're willing to spend the time and money to stay healthy?
Absolutely. And I think that's part of, when I see a client for the first time, as much as they're kind of interviewing me, I'm interviewing them as well, because I want patients that want to care for themselves, because it takes that you power in order to be able to become healthy.
It's a commitment.
It is. It's absolutely a commitment. And
it's a discipline of life, health.
Yeah.
Absolutely.
Mm-hmm. So, Melissa,
what's
our first question
for Ask Robert?
Our first question today comes from Anthony in San Jose. Favorite book, Rich Dad, Poor Dad. Says, what is the difference between healthcare and wealth care?
That's a very good question. I don't think there's much difference between it, really. What you have in this room are my advisors. And I always hear me barking on this program when just yesterday on the last Rich Dad radio program, this guy asked me a question that involved an attorney's advice, and he also asked me a financial question that involved an accountant's advice. So my only question to him was, who is your accountant and who is your attorney? And the trouble is, most people, and I think you guys see it all the time, people in my world of money, they're trying to play accountant and attorney, and in your world, they're trying to play doctor themselves, right? They go, I can fix this, and they don't come to you. And I'll bet you a lot of times they don't even ask you they're afraid to ask you the question because they're afraid of getting the answer. I mean, they're so afraid of finding out whatever the truth is. Would you say that's true, Sunil?
Oh, absolutely. It may start out like that, but that's where the education kind of turns them around to where they realize that they have to be accountable.
They don't have to know all the answers, do they?
No. Well, a lot of times they know the answer. They're just not listening to themselves.
Stay off those McDonald's.
Because they're not paying attention to what their body's telling them.
Right. Correct.
So,
it's just. It's a cycle that just gets perpetuated over and over and over.
And a lot of people
until
say
it turns into something more significant.
And healthcare and wealthcare, the same thing as, well, I can't afford it. I'll do it when I'm rich.
Right.
But isn't Oh, go ahead.
No, I was going to say, you can't wait for a disease to happen. You have to be preventative, and it's the same way, from a financial standpoint.
So wouldn't you call the insurance companies and big pharma, isn't that wealth care?
Yes, depends on how you're looking. So you're right. I mean, I think there is another way of looking at it. Is wealth care is, are you caring about wealth? Healthcare is, are you caring about health? So when you look at the healthcare system as a whole, what the name tells you is it's caring about health. But is that entirely true? So it is changing to a point where the healthcare system is now dominated by an interest of maintaining wealth and finances than maintaining the health of an individual patient or a person. So as Robert said, they are both coming together and confusing not only the providers, even the patients. And one of the reasons why a lot of patients are dissatisfied with our healthcare system.
And one of the things that's right, and it doesn't have to cost a lot of money, is hanging out with these three people, is I've just changed, a lot of it's just my diet. I eat more raw vegetables or vegetables versus a steak. And just shifting some of the priorities, whereas before I'd eat a 2-pound steak and have some French fries with it.
Oh, my diet as a 20-year-old lunch was coffee and cookies.
You can be proactive is what we're saying. It doesn't have to cost you money, but as Dr. Gopalan says, it's being, aware, being cognizant of it.
Melissa, next question.
Our next question comes from Bren in Tempe, Arizona. Favorite book, Rich Woman.
Yay, Bren, I love you.
Smart guy.
Love you. I could be a woman.
The question is, what should you ask or know before hiring a naturopath? In other words, how do you know who is better than someone else?
That's a great question, Dr. Sunil.
Oh, good.
How do you know?
That's a really good question. Just do your research. One thing is you want to make sure that the naturopathic doctor is licensed in that state.
That helps.
That's super important. And then it's always good to have a word of mouth or like a recommendation.
If I were to come to you, what questions could I ask you to find out if you were the real thing?
Well, I think it's just it's trying to find out about the philosophy. I practice naturopathic medicine without a closed mind, and I recognize that there's a time and place for medicine. Sometimes surgery is necessary, but I also know that you address that issue at hand, and then you maintain and you prevent that from happening in the future. So I think the philosophy is huge. There's some naturopathic doctors, unfortunately, who are very one-sided and can't embrace all sides of medicine.
And some of them are really sick people themselves. I've gone to a number of. I remember this one acupuncturist in Honolulu. I walked into his office, and I thought I was going to get cancer walking in there. He was such a sick individual. He just sat there and popped and cracked you, but his whole environment was sick and toxic. So that was
energetically, that's huge.
Yeah, he was cheap. He was cheap, though. But the other thing is that the reason we got to Dr. Jane is simply because our neighbor recommended him. And exactly what it says is when you have people who are proactive, you want to hang out with other proactive people. And it's just like money. A lot of people take financial advice from their friends who are poor. And you want to take health advice from people who are proactive about health. And like I said, my friend who is now like Kim and I on private physicians, health is everything to this guy. He and his wife are like monsters when it comes to health. They're fanatical, right?
Yes, and you said something else, Dr. Sunil. You said philosophy. And Robert and Dr. Radha, you came to Radha with a heart problem, but you guys connected because you had a similar philosophy on health. And I thought that was crucial.
Exactly. And I think it's when I read that question, I was just going to make the comment at the end of it to Bryn, is that you're not hiring a naturopath. You are making a partnership with a naturopath. That may also mean you might change physicians and find someone who is aligned with the philosophy of yours, who's unique to you and be able to work with you. It's a partnership. It's never hiring, because when you hire someone, you're expecting that person to deliver something to you. It doesn't happen that way.
Good point.
It's working together.
Nicole.
I also just want to make a point. You want to make sure that you find somebody that respects you and your opinion and your beliefs, not somebody that's going to tell you no, or somebody that doesn't see both sides of the spectrum. Just like if you're finding a Western practitioner, they should respect if you also want to see a naturopath, so you can really get that holistic approach, from both Eastern and Western sides of medicine.
Great point.
And that's a very important point, because the reason I go to see Dr. Gopalan and Sunil and Nicole is I want to stay off of drugs.
Yes.
And that means I have to get healthy.
I don't want to go to the hospital.
Yeah. If I want to use drugs, I don't have to be that healthy. And it comes down to the philosophy on drugs. My mother was a registered nurse, and she was anti-medicine. It was kind of interesting talking to her all the time. She says, "Oh, those SOBs, pompous, those doctors and all that. They think they're God or something." So my mother was very much into the natural side, which was important. Unfortunately, my dad was on the other side of it. He was into 2 packs of cigarettes a day, Jack Daniels, and no exercise. Yet my dad outlived my mom for some reason. So a lot of it's genetics. So that's the final question. How does genetic play into this real quickly? DNA and all this.
Yes, they do play a role in it. But I want to make this point. Just because you are genetically predisposed doesn't mean that you have to manifest it.
Is that correct,
What does
Dr.
that? What
Jain?
does that mean? Wait. What does that mean?
You may not have to develop the disease.
So you might have the genes, or you might have the.
Right. So, for example, your mother may have had breast cancer.
Okay.
But doesn't necessarily mean you have to develop breast cancer just because you inherited that or if you have it in the family history.
Dr. Jain?
Yeah, so we know that you can turn genes on and off. Just the power of thought. Being stress-free, when you're stressed out, you're actually causing DNA damage. So you're promoting that gene to turn on.